So next, Swapna Godugu, be ready. After that one, Ashwini, be ready. Victoria, you are not responding. I don't know whether I know you or not. If you are regular student, you message me. Okay. So next, Swapna Godugu, be ready. After that one, Ashwini, be ready. Victoria.
Hello.
Yeah, Victoria. So are you my regular student or you a guest now?
Guess.
Okay, you are a guest. You can do one speaking session. You can prepare any one card. I'll give you one free session. Okay. Right. Where are you from?
I'm from Nigeria.
Oh, Nigeria. The people who love me very much. There are many Nigerians who like me very much. Many members.
Sir, I'm just listening. Oh, I'm not
Okay,
ready.
no problem. No problem. If you are interested, you can tell me. I told, not must. Okay. Right.
Okay, sir.
Okay. You
Thank
can
you.
mute back.
Okay.
Yeah. Safuratu. Yes. So if you before we commence the session, if you have any questions to ask me, you are welcome, Safu. Safuratu, do you want to ask me any other questions?
No, sir.
Yeah, you can start straight away then.
Okay, so all right. Good morning. My name is Safuratu Hassan. I am one of the nurses in this hospital, in this clinic. So please, how may I address you?
Yeah, you can call me Ben Johnson, Mr. Ben Johnson. So I am 60 years old and the doctor has asked me to meet you, nurse.
All right. So, Mr. Johnson, thank you for telling me your name. From the case notes, I could see that your doctor asked you to come and see me regarding some insulin injections that I'm supposed to teach you and also address any concerns that you have. Is that correct?
Yeah, you are absolutely right. But I have a big question, Why does the doctor want me to take insulin injections? I have been managing well with my diabetes diet, medication regimen, and exercise program. So what's wrong with this doctor? He tells me to change it to insulin injection regimen. What's the reason behind it?
Okay, Mr. Johnson, I really appreciate your concern and your question. So I regarding the case notes, the doctor is saying you really manage your diet, you really manage your diabetes well, but recently you are not responding well to treatment. So that is why he has now switched to injections, which will give you a faster results. Is that okay?
I don't know whether it is okay or not, nurse, but doctor knows better, I think. So I'll follow his suggestions. That's nothing else to do. Now tell me more about this. How am I going to? Actually, I'm very much scared of injections. I don't know whether I can take it on my own. How is it possible, nurse? Will I be able to do it?
Okay, Mr. Johnson, I appreciate your worries. I would say that um, giving the giving yourself an injection will not be a problem at all because this needle that we use for giving the injection is a very thin and fine needle. So it's not going to be any long-term pain that you are going to experience. It's just going to be like a pinch, and then that's all. There wouldn't be any other problem. Sorry. So, do you have any other concerns? How do you feel about this injection process?
I cannot tell you much, nurse, but I'm a little bit scared. But I'll definitely follow you. Now, tell me, where should I take these injections exactly? And yeah, can you tell me the procedure for this?
Okay. So, Mr. Tariq, first, you need to wash your hands very well, and then you wherever you because the this notice you can give the injections in your inner aspect of the thigh and then your abdomen. So wherever that is convenient for you, you just pinch the space where you are coming to give the injection. And then as you inject, you go 45 to 90 degrees angle, and then you leave the injection in place for about 5 to 10 seconds before you can push the drug and then you move it. It is really important to change or rotate the injection site so that you not have lumps or poor absorption with time. Exactly.
Yeah, that's a very good explanation, nurse. And then regarding this, okay, injections. So should I use the same needles and syringes every day, or should I change it on a daily basis?
I appreciate your question, Mr. Johnson. Before I come to your question, I would like to stress on the importance of the insulin injection that you are coming to um, is being initiated for you. First of all, it gives faster absorption into the bloodstream. Um, before you used to take oral, which has to go into the stomach before it will be broken down and then into the bloodstream. However, with this new development, it just has to go straight into your bloodstream, therefore making it more effective than the oral one. Okay, so now back to your question. You wanted to know um, if you should use the same needle. Mr. Johnson, I appreciate your concern. Yes, so what you really need to do is to get suitable containers, especially those that are not punch proof, those that needles cannot punch through, and then you make sure you handle it properly. Again, you try as much as possible to refrigerate the insulin after opening, and you try and check the expiring date. You you also make sure that you don't keep it under hot temperatures or very low temperatures or cold temperatures. So it has a normal temperature range that is supposed to go in. Is that okay?
Yeah, that's
So the
definitely
needle will,
okay, nurse.
yes, each after each injection, you discard the needle or you put the needle in the sharps box, making sure that it doesn't prick you. Okay. I
Yeah.
hope I've answered your question.
Yeah, of course. You have given me a clear picture, no doubt regarding that. Now, I want to ask you regarding, yeah, will there be any side effects or ongoing problems or anything like bruising or itching or something like that?
I appreciate your concern, Mr. Johnson. Regarding itchiness and other side effects, I cannot really promise you that. But the only thing I know is if you keep on injecting the same side, that is when you tend to have redness, itchiness, and then a lump around the same area you keep on injecting. So my best advice to curb this problem is to rotate the injection site so that you don't have any side effect. Other than that, if you follow keenly the amount you are supposed to take and when you are supposed to take, you are good to go, Mr. Johnson.
Okay, that's
I've
quite
been
fine. I really thank
waiting.
you very much, nurse. Now you can sit back and you can see me how I am going to take the insulin injections. Thank you very much for the explanation. If there is any problem, you can stop me and suggest me alternatives.
Mr. Johnson, I really appreciate you. We will also give you leaflets that gives you clear instruction regarding the injection process. However, we are always around, so when you have any questions, you can contact us for answers. Thank you.
Yes, nurse. Thank you very, very much.
My pleasure.
Yeah.
Mhm.